Singapore has unveiled measures to prepare for a possible Omicron wave. Now, this includes more hospital beds and pressing on more urgently with its COVID-19 booster vaccination program. 16 cases of Omicron have been reported here so far. There is no local transmission, but Singapore's pandemic taskforce says it cannot let its guard down. Sherlyn Sia with this report.
The task force has come up with a multi-pronged approach, covering vaccinations, stepping up hospital capacity, and also enhanced safe management measures. Vaccines are the main tool going forward, and specifically boosters. Studies have shown that vaccine effectiveness against Omicron infection drops to about 50% 3 months after a second dose. But 2 weeks after a booster, its effectiveness against Omicron goes back up to 75%. As such, boosters will be expanded to those aged between 18 and 29 years old. And with vaccination of children between 5 and 11, Singapore expects to administer over 2 million doses these 2 months. With waning immunity, Singapore will set a validity period for full vaccination status. It will only last a limited time after 2 doses of mRNA vaccines or 3 doses of the Sinovac or Sinopharm shots. The MTF is working on a suitable duration, and more details will be announced soon. But even with vaccines, the task force says it's only a matter of time before Omicron hits Singapore, and it will not be realistic to totally stop its spread. That's why we're boosting our hospital capacity to prepare for any worst-case scenario. ICU beds will be increased. Currently, Singapore has about 280 of such beds meant for COVID patients, with the ability to increase that to 350. With Omicron, that could now go up to 500.
We do have sufficient stock of ICU equipment, medications and other treatments to care for this projected number of ICU patients. And we've worked with our public hospitals to study whether infrastructure upgrading needs to be done to better support and provide care in our hospitals. We've reviewed our clinical protocols and processes regularly with our intensive care specialists and infectious diseases experts. These protocols were tested when we experienced our surge of community cases with increased hospital admissions in October and November.
On treatments, Singapore is also boosting its arsenal and preparing them to treat potentially severe cases of different variety. The MTF is reviewing if they would still be effective with the Omicron variant, but say that most of them would remain suitable. The task force is once again emphasizing that we should not let our guard down with the evolving variant situation. Although some reports have said that Omicron seems to be less severe and less fatal, it can still impact Singapore greatly. That's because its higher transmissibility could still lead to more cases and more severe outcomes. They are calling for everyone to stay vigilant, especially as we enter the festive season.
Well, at the same time, Singapore is expanding its vaccination differentiated safe management measures, or VDS, to more areas from next February. This includes all indoor sports facilities and guests in hotels. From the 1st of February, all events must also implement VDS to proceed. Currently, only events with more than 50 attendees are required to do so. The task force says there are no plans for now to introduce VDS for children aged 12 years and below. Still, Singapore will continue opening up in other areas for the vaccinated. From January, 50% of those who can work from home will be allowed to return to the office. About 3% of the workforce are not yet fully vaccinated, and the task force says it is considering removing the concession for unvaccinated persons to return to work sites with a negative COVID-19 test. Our business associations say it's likely the concession will be removed and that employers and affected staff should discuss possible work arrangements.
Working from home is still an option, and depending on what kind of work they're doing now, if MTF does choose to move forward and not allow unvaccinated people back into the workplace, then I think people who continue to choose not to be vaccinated has to work out some arrangement, right, with their employers, whether they can continue to work remotely or maybe choose a gig economy kind of work going forward.
Companies would need to adjust their work scope to allow employees who are unvaccinated to work from home. And secondly, we do hope that MTF would provide companies with more time to adjust to these changes. And thirdly, I think very importantly, is for employees to get vaccinated if they are already not vaccinated.
From next Monday, citizens of Singapore and Malaysia will also be allowed on the quarantine-free land travel lane between the two countries. The task force explains their rationale for seemingly relaxing and yet tightening the measures in the face of a potential surge in Omicron cases here.
The whole point of us trying to adapt to COVID-19 and living with it as an endemic disease means that with each wave, we should find ourselves more resilient. More resilient means don't go back to CB. And if we push ourselves further, don't go back to P2HA. And we have to try our best to be able to open up gradually, and each time we see another wave, new clusters forming, we don't have to throttle all the way back into very painful, safe social restrictions.
The task force has also revealed that Singapore has been seeing about 2 cases of multi-system inflammatory syndrome among children weekly, with some requiring ICU care since mid-October. Senior Minister of State for Health, General Puducherry, explained that it's important for young children to get their jabs, and this is because many of them spend a lot of time in places like schools, where transmission can spread quickly. This could in turn place their family members at risk.
Getting our children aged 5 years and older to receive the COVID-19 vaccination will help protect our children from getting the COVID-19 infection and keep them from getting seriously sick even if they do get COVID-19. So, reducing the risk of severe complications such as MIS-C.
It's been announced that more than 300,000 children aged 5 to 11 will be able to book their COVID vaccination slots from next week. Education Minister Chan Chun Sing says that this will go ahead if the pediatric doses of the Pfizer-BioNTech Comirnaty vaccine arrive as scheduled. The vaccination exercise will start with children in primary 3 to 5 from the end of this month, while the younger ones, well, they will get their jabs early next year.